Are you suffering from headaches, chronic or severe back pain, or even recovering from a surgery? Then you have heard of the drug I'm going to spend a few minutes discussing today. I'm going to spend some time talking about opioids and why so many people have been prescribed them. But in the end, thousands of individuals become addicted, leading to high opioid overdose rates in the United States. In part 1 of this video, I will explain what opioids are, some commonly used opioids, how they work in someone's body, and some side effects to these drugs. To begin, opiates are found in the sap of the opium poppy plant, a beautiful plant that produces such a harmful medication that puts many people at risk and include opium, morphine, and codeine, made directly from this poppy plant shown. Opioids are a compound resembling opium in addictive properties or physiological effects. These opioids are prescribed by doctors and are not available as over-the-counter. Opiates and opioids behave the same way in the body due to the similarity in their chemical structure. They are used by individuals suffering from back pain, headaches, or recovering from surgery, as stated earlier, and are primarily used because of their ability to relax an individual to help relieve pain they are feeling. Although opioids are extremely helpful in relieving pain, they are by far the most abused drug in the United States. Here is a brief list of commonly used opioids: hydrocodone, oxycodone, oxymorphone, morphine, codeine, fentanyl, and heroin, to name a few. The brand name is shown in parentheses for some of these commonly used opioids, and the opioids listed are known as narcotics. Now that we know what opioids are, let's take a look at how they work inside the body. Opioids have the ability of attaching to proteins, which are opioid receptors on nerve cells in the brain and spinal cord. When the opioids attach, it will block the pain messages sent from your body through the brain and will relieve the pain. Although they do relieve pain, they can become very addictive over time. Heroin, for example, reaches your brain, binding to receptors which will produce dopamine, therefore triggering a sensation of pain relief and pleasure, as most people would describe as a high. After an individual begins taking opioids for pain relief, when their prescription ends, they typically find other ways to get more pills because they like the feeling. Opioids become addictive because over time, someone who uses will need higher and higher doses to get the high they were once feeling when they began taking them, and will develop a tolerance which leads to addiction to opioids in many of the cases. But when taking any medication, there are always side effects that come with them. Short-term side effects to opioids includes feeling of euphoria, which is a state of extreme happiness, pain relief, drowsiness, and even sedation. Some long-term effects are nausea and vomiting, abdominal distension and bloating, constipation, liver damage, development of tolerance and dependence, even addiction in some cases. Part 2 will focus on tolerance versus dependence versus addiction, an overdose video, signs of an overdose, the drug to reverse an overdose, Narcan, and treatments to help someone who is suffering from opioid dependence and/or addiction. Tolerance to a drug can be explained as a person does not respond to a drug as they did the first time. Therefore, each repeated use after will need to be higher doses to get the same effect for the initial one. Next is dependence, which is when an individual stops using. The body will go through withdrawals. Some withdrawal symptoms include restlessness, muscle and bone pain, insomnia, diarrhea, and vomiting, to name a few. Finally, addiction. This is a condition where the body adapts to the presence of a drug in someone's system, and the person will continue to use drugs and will not be able to. Warning! This is a video of a girl and her boyfriend feeding their addiction of heroin and bath salts.
I like spending time with my boyfriend because he doesn't really judge me for what I do. Brandon, come here.
It's just not a good relationship because Alyssa is with Brandon for drugs.
All right, you need to put your arm up.
Go this way.
Oh, sorry. All right. No pain, no gain.
Brandon don't care about her.
You taking forever.
I know.
He would put her in harm's way. It's scary thinking about where Alyssa could be and what she's doing.
All the money that she would get from it, she would give to him, and then he would buy drugs with it and give her a small portion of the drugs. Then as soon as those were gone, she'd prostitute again.
I know you're doing this. Oh, Brandon, hold on. A lot of people have turned their back on me, but Brandon's always there for me. I don't care what people think. I don't care what people say.
If someone has overdosed from opioids, there are signs to look for. Blue lips or nails, dizziness or confusion, cannot be woken up, choking or gurgling, slow or no breathing, and drowsiness or difficulty staying awake. When someone is found from a drug overdose, naloxone, also known as Narcan, is administered. Narcan works by pushing the opioids off of the opioid receptors and will sit in the place of the opioids to reverse the effects of the overdose. After administering the Narcan nasal spray, symptoms could come back, and if this happens, another dose can be given after 2 to 3 minutes and a new bottle is used. There's a chance that the nasal spray may cause side effects after being given. These could include body aches, diarrhea, increased heart rate, sweating, nervousness, irritability, or even trembling. Narcan is easy to give with no medical training, covered by most insurance plans, and it is available from pharmacists with no prescription needed. But if the person wakes up after Narcan is given, they should still be taken to the hospital to be seen by a doctor. Now, Narcan is available to the public over the counter to carry and use when they are caught in an overdose situation. To help someone get clean from an opioid addiction problem, scientists look for treatments that are effective to the patient. There are 2 main ways to treat an opioid addiction. Number 1, detoxification followed by complete abstinence. Individuals who follow this route will go through detoxification and withdrawals and will go without any opioid drug. But this route is long and very difficult and has high risk of relapse. Number 2, detoxification, medication, assisted treatment. This will make the detox much safer and easier to manage. Once detox has occurred, MAT involved treatment with a medication of either methadone or buprenorphine. There is still a chance of relapse with this pathway, but it is less likely than someone receiving no medication at all. Here is a video of Rebecca's story and her going through a detox.
Like it was take these, you'll feel better, and that was it. And then 2 months later, I had to have it already, like just from the pain pills. So that's when the heroin started.
Today is the second day of Rebecca's detox. She has not used any substances for over 24 hours now. She is experiencing exactly what one would expect under these circumstances. She's very tired, her body is starting to ache.
It's like you're hot, but you're cold at the same time, and you're sweating. You can't get comfortable, and every move you make, it's like you're running a marathon. Like, it takes all your energy. It's just draining.
Part 3 will consist of the opioid epidemic, statistics, and opioid lawsuits that are currently going on. The opioid epidemic occurred in 3 different waves. It began in 1991 when deaths began to increase dramatically when opioid and opioid combination medications were being prescribed to treat individuals suffering from pain. Opioids began to be prescribed to individuals because pharmaceutical companies reassured prescribers that the risk of becoming addicted to prescription opioids was extremely low. Opioids were also promoted to individuals with non-cancer related pain, but by 1996, over 20 years ago, 86% of people using opioids were not using the pain medication for cancer-related pain. The problem that occurred during this time was the prescriptions were readily available, and in these communities, there was an increase in opioid abuse. Another wave of the epidemic began in 2010, when a large number of deaths occurred due to heroin abuse. To help decrease this problem, they began to make opioids much harder to get, but unfortunately, heroin is a very easy drug to find as well as being cheap. Therefore, the use of heroin increased in both women and men. To put this into statistical terms, heroin deaths by overdose increased 286% in 11 years, and 80% of these individuals admitted to misusing the drug. In 2013, the final opioid epidemic wave started. This wave was related to synthetic opioids, for example, fentanyl, with 20,000 people dying. But as much as we try to combat this issue, it is still occurring as of today. Over the past 20 years, opioid use has increased drastically and is still on the uprise today. Opioid overdose, as of today, is the #1 leading cause of deaths in the United States. Yes, you heard that right, the #1 leading cause of deaths in the U.S. The first graph shows the national drug overdose deaths among all ages, categorized by gender, from 1999 to 2017. According to the CDC, in 2017, just 2 years ago, over 70,000 Americans died from a drug overdose, which included prescription opioids. From 1999 to 2017, the overdose deaths number increased from 16,849 to 70,237, which is a significant increase in 18 years. The second graph shows overdose deaths involving any opioid, and overdose numbers started at 8,048 in 1999 and rose to 47,600 by 2017. Based on this figure, there has been a high number of males overdosing than females, but it is happening between both sexes. As of right now, there are drug lawsuits happening. Who is to blame for the drug lawsuits? Should the pharmaceutical companies be blamed for America's opioid problem? Science says that legal evidence is needed to know whether addiction and death due to opioids is because of the pharmaceutical companies or because legal prescriptions are readily available. Purdue Pharma, who makes OxyContin, has legal hits occurring right now. Purdue Pharma settled a lawsuit for $270 million with Oklahoma. Purdue was advertising OxyContin, and they advertise it as less addictive than it is, which led to an opioid use and overdose epidemic. Therefore, is Purdue Pharma the reason for high rates for opioid addiction? In this situation, courts will decide who is responsible for America's opioid crisis we are in right now. At this moment, attorney generals are asking if the pharmaceutical companies can be to blame and held legally responsible for our opioid crisis. Recently, Ohio's attorney general filed a lawsuit against more than one pharmaceutical company on marketing campaigns for their drug. This lawsuit is similar to other lawsuits happening in Illinois, Mississippi, counties in New York, Santa Clara, and California. New York sued Purdue Pharma owners for triggering our U.S. addiction epidemic with the marketing of OxyContin 2 days after this company paid $270 million to settle claims by Oklahoma. With this being said, the lawsuits are going to continue until courts have decided who is to blame for the American opioid epidemic still going on today. In closing, with watching this video, learning more about the opioid epidemic, and seeing this data, it is scary to think how many people are overdosing every year and how this number continues to increase, let alone how many people per day are dying to an opioid overdose, with that number being about 130 people per day.